Welcome. Let us talk about how to evaluate hypoperfusion or shock at the patient's bedside. As you are evaluating the patient, there are 4 bedside indicators of shock to pay close attention to. Others, such as lactate and bedside ultrasound, are useful, but as their availability and time to acquisition varies dramatically, we are going to focus on 4 easily available bedside indicators of shock. That is to say, inadequate tissue perfusion. These 4 items are heart rate and blood pressure, mental status changes different from normal for a patient, capillary refill in the extremities, and urine output over time. Commonly, we think of patients with a blood pressure of less than 90 millimeters of mercury as being in shock. Hypotension is concerning for shock, but it is a late finding. When evaluating the cardiovascular system, using both the heart rate in addition to the blood pressure is more sensitive and better able to detect a patient who is in early shock. The term for using the systolic blood pressure and heart rate together is shock index. Take the heart rate and divide it by the systolic blood pressure. In this case, it is 100 divided by 90, which is equal to 1.1. With shock index, heart rate divided by systolic blood pressure of 1 or more is concerning for a cardiovascular system under stress and early shock. So always take extra time to think about these patients and gather more information. For evaluating mental status, think about the AVPU scale. If the patient is alert and at their baseline, that is a good sign. Any other categorization on the AVPU scale, verbal, pain, or unresponsive, is concerning, and you should ask the patient and family members if this is their normal mental status and level of consciousness. If this level of consciousness is new, it could be a sign that the brain is not getting its normal blood flow and is hypoperfused. The patient may be in shock. We should also check the hands and feet. A normal finding would be warm hands and feet with a capillary refill of less than 2 seconds. If the hands and feet are cold or the capillary refill is greater than 4 seconds, this is concerning that the patient's extremities are not getting their usual blood flow and the patient is in shock. Finally, when a patient is getting IV fluids to resuscitate them, it is normal to measure a urine output of 1 milliliter per kilogram per hour or more. If you monitor the urine output for at least 30 minutes and the urine output is less than 0.5 milliliters per kilogram per hour, this is a sign that the kidneys and your patient may be experiencing low blood flow due to shock. Remember, to monitor this over time to look for any improvement or worsening. In summary, 4 useful bedside signs of shock for both COVID-19 and other patients are a heart rate divided by systolic blood pressure, often called shock index, of 1 or greater, a change in mental status, cold hands and feet, or a capillary refill greater than 4 seconds, and a urine output less than 0.5 milliliters per kilogram per hour measured over at least 30 minutes. Thank you.